Public health experts say it's an early start to tick season. Hospitals already seeing an unusually high number of emergency room visits for tick bites.
And as Tony Aiello reports, that's raising concerns about Lyme disease and other tick-borne illnesses.
Set on 2,000 acres in Dutchess County, the renowned Kerry Institute for Ecosystem Studies.
Look at it under the scope to make sure what species of tick it is.
Where Dr. Richard Oswalt has spent decades studying ticks and Lyme disease.
We have roughly 500,000 new cases of Lyme disease in the U.S. every year. So it's always a problem, but there's some years that are much worse than others.
2025 may be one of those years, with hospital ERs already reporting the number of tick bite cases usually seen in early June.
That as the climate warms, the ticks come out earlier in the season. So that appears to be what's going on right now. This is true in the Northeast as well as other parts of the U.S. where this tick season is getting off to a galloping start.
At Northwell Health Northern Westchester Hospital, Dr. Evan Cohen says a tick bite is no reason to panic.
Most ticks do not carry Lyme disease, do not carry babesiosis or anaplasma, and so not to be alarmed. Also, when a tick is only on for a few hours and it's not engorged, the risk that that tick is going to transmit Lyme is very, very low.
Dr. Cohen says Lyme, the most common tick-borne illness, is generally treatable with antibiotics. Back at the Kerry Institute, Dr. Oswalt told me the early tick season is a cause for concern, not an excuse to avoid time outdoors.
We need to start now, being very vigilant, doing tick checks, using repellents, taking care of ourselves and our family.
Prevention that can help you avoid the big health concerns caused by those tiny ticks. Tony Aiello, CBS News, New York.
The blackleg tick has been the traditional concern here in the Northeast. Now experts are monitoring two other species showing up here, the Lone Star and the Longhorn.
Gotta make sure that repellent has DEET in it, right?
Yeah, absolutely.